We've heard it said that you shouldn't lift something too heavy because you might get a hernia, right? But is that actually true? We're discussing what a hernia is and how it's addressed. This is Flushing Hospital MedTalk, a podcast sponsored by Flushing Hospital Medical Center. Thanks for listening. I'm Joey Waller. Our guest, Dr. Noman Khan, a bariatric and general and minimally invasive surgeon, as well as chair of robotic surgery at Flushing Hospital Medical Center. Dr. Khan, thanks for joining us.
Thank you for having me.
Great to have you with us. So first, simply put, what is a hernia for those unfamiliar, and what typically causes it?
So the easiest way to define a hernia would be basically it's a weakness in the abdominal wall usually. And through that abdominal wall, you can have a protrusion. So the abdominal contents can be your intestines, can be the fat inside your body, and those can actually protrude through a weakness in your abdominal cavity that either you were born with or you acquired over time. Of course, there's various types, and we'll cover that as well.
Well, why don't we go ahead and do that? You led me right into my next question beautifully. So there are different types. What are they and what distinguishes them?
So the most common type that you'll usually run into are what people call groin hernias, which we call inguinal hernias. So in those hernias, what happens is basically there's a weakness in the lower area of the abdominal wall. Some people are born with it and some people acquire it over time from such things as lifting, chronic constipation, and so on and so forth. So these are basically hernias that come through in the groin area and sometimes can be noticed as a bulge or an uncomfortable bulge in the area, especially in men leading down into the scrotal area as well. The next types are femoral hernia, which is more closer to the thigh area, which we more commonly see in women. And that's in the top of the inner thigh. And those can be particularly uncomfortable and at times dangerous because they can become trapped or strangulated, incarcerated, as we sometimes call it, which I'll also go into a little bit more. An umbilical hernia is right at the belly button, or the umbilicus as we call it, and that's a protrusion that you can see there. Some people see that as basically more of a outie belly button. They may see they've always had it in some cases, which they could be born with. And then finally, we have hiatal hernias or hiatus hernias. So those are hernias that basically are a little bit different. They are not visible from the outside, and they can actually be where your stomach is protruding from your abdominal cavity into your chest. So that's a little bit of a different kind of hernia, and I think we'll talk more about the abdominal wall hernias today.
Yes, and speaking of which, just to follow up on something you mentioned there, you said that some people are more prone to getting a groin hernia, right? And I'm wondering, therefore, to go back to what I mentioned at the top, where sometimes people might be leery of lifting something too heavy because they're worried about a hernia. Is it normally, if they get one, more because they were prone beforehand or because of the act, or maybe a combination of the two?
It can be a combination of the two in most cases, and that's a good question. Often people ask me, well, if I exercise a lot or if I lift frequently, am I going to end up with a hernia? And the answer is no, not necessarily. However, if you already have a weakness in that area that, again, you could have been born with, or it could be formed over time from repeated lifting, especially if you lift incorrectly. So if you increase your intra-abdominal pressure, meaning you lift incorrectly, you don't bend your knees, you lift very heavy objects directly off of the floor, then you may increase your intra-abdominal pressure and give more pressure in that weakness that would cause you to form a hernia. However, in some cases, you're already born with a small hernia, and that hernia inevitably gets larger over time. And that can be due to the intra-abdominal pressure from things like lifting, but it can also be due to things like straining, constipation, a heavy cough, especially in smokers. Things like that can also lead to hernias or lead to an increase in the size of a hernia that you already have.
Gotcha. Now, are there always obvious hernia symptoms to a person, and which are the most common?
So that's a good question, because a lot of times people ask me, well, I have a hernia, but I don't feel anything. And is that still a problem? And the answer is sometimes yes or no. So in respect to what you can feel, you may just see a swelling or a bulge. You may see a pouch in the area, especially in the groin. You may notice that one side sticks out more than the other. And that particular side could also have an aching sensation, a pulling, or you could even feel like sometimes it pops out. When you lay down and relax and you push it back in, it goes right back in. That's almost a sure sign that you have a hernia, and that's something that you should probably have repaired.
Yeah, I can recall when I had my hernia in my right groin several years ago that I had already been diagnosed and was scheduled for surgery, but I had to wait about a week or two to have it done. And there was one night in New York City where I was trying to find my car that was parked in an area that I wasn't used to parking in. And I couldn't find the car, and I was walking and walking and going in the wrong direction. And that hernia, I could feel it popping through more and more, and I've never been in more agony in my life. I can laugh about it now. And as you alluded to, Doc, it wasn't until I got into the car and was able to sit and relax that finally it went away. I didn't know if I was going to make it that night. That was a little rough.
Yeah, that sounds particularly uncomfortable. And in cases like that, especially when I see patients with hernias like that can make you that uncomfortable and that need you to lay down and reduce, I would 100% recommend repair.
Absolutely. And so, of course, I went ahead and got that done. Now, if you do have a hernia, what are the treatment options?
So the first thing you want to do if you have a hernia is you want to speak with your primary care physician about the fact that you suspect you have a hernia. Usually just by physical exam, your primary care provider can tell if you do indeed have a hernia. Very rarely do we need imaging such as a CAT scan or other things to diagnose a hernia, since they're usually pretty obvious on exam. Now, once you've established you have a hernia, your primary care physician is going to send you to someone like me. And basically, a surgeon can decide and discuss your treatment options with you on what needs to be done next. You don't want to ignore hernias because it's hard to tell which hernias exactly are of high concern and low concern, and your surgeon can have that conversation with you on whether or not it's necessary to repair. Early repair is usually the better option because hernias grow over time almost without exception. So you do want to approach early on with your primary care and say, I may have a discomfort here. Is it a hernia? Now, if you've decided, yes, it is a hernia with your primary care, then the next step would be to speak with a surgeon.
And so that's where you would come in. And what are the options? I know that something called the mesh procedure is the most common, right?
That's correct. So mesh is a part of the many types of procedure that we do. So I'm going to start from types of hernias. Again, I'm just going to go back to what we discussed because it's important to consider the type of hernia before we talk about how we can repair it. So the most common type, as I had suggested earlier, is the inguinal hernia or the groin hernia, as some people call it. That hernia can be repaired basically in two ways, or three, if we include robotic, which I'd like to get into as well. The first of which is called an open repair, and that's where an incision is made over the top of the groin hernia itself, and the groin hernia is reduced back into the abdominal cavity. The weakness or the opening, which is the hernia itself, is found, and that's repaired. And almost without exception, a mesh is placed over that region, which you alluded to. And then the tissue over the mesh is closed, and then the incision itself is closed. So what this does is it reinforces the weakness in the abdominal wall. The mesh is a very necessary part of this in most hernias because the tissue itself is already weak. So just repairing it with suturing would result in a unacceptably high rate of them coming back, or what we call recurrence rate. So therefore, we put a mesh over the top of the hernia to sort of give that abdominal wall more strength. The other options are laparoscopic or robotic. So laparoscopic is a word that basically indicates that we do something minimally invasive. We make small incisions on the abdominal wall, and we enter the abdominal wall with instruments and a camera, and we can repair the hernia without making a larger incision. Now, the advantage of this is that it basically allows you to heal faster. The recovery time is shorter, and most people have less pain after a laparoscopic repair. The chance of the hernia coming back, the chance of infection, all of them seem to be equivalent between open and laparoscopic repairs, and open repairs are still done more widely nationwide than laparoscopic repairs. Now, robotic repairs are very similar to laparoscopic repairs, except, of course, we're using a robot. So we have small incisions again, we're entering the abdominal cavity, and we have a robot with instruments on it. Now, what does the robot do? The robot gives the surgeon an advantage in that we can operate in much smaller spaces, we have much more precise instruments, and we can see things in 3D and high definition inside your body without having to cut and make large incisions and open them up. So robotic surgery is fast gaining traction as far as hernias go, and we're seeing more and more surgeons adopt it as a way to do a hernia minimally invasive. Now, the umbilical hernia is also fixed in a similar fashion. You again have both options, and they're very similar. You can make an incision over the top of the umbilical hernia, and you can repair it with mesh, or you can do a laparoscopic repair or a robotic repair, which again gives you the same advantages. Another type of hernia that we're seeing more and more, and many people come to us with, is an incisional hernia. What that means is that you've had surgery before. So if you have an incisional hernia, it may be anywhere in the abdomen where you've had surgery, whether or not it was done with a large incision or a small incision, you may form a hernia. These hernias as well, the repair options are very similar. We can make a large incision over the hernia itself and repair it with a mesh, which may be inside of your abdomen or outside of your abdomen. We can laparoscopically repair it and approach it from the inside, and we can again robotically repair it. In the robotic repair, the big advantage with the incisional hernias is in many cases they can be extremely complex. So if they are complex, then the robot gives us the advantage of having the ability to do very, very complex hernias and still, for the patient, have very small incisions. So it's a hernia that may have needed a very, very large incision, now done through small incisions. And in most cases, I have my patients tell me, even with complex repairs or with robotic inguinal or with robotic ventrals, ventral refers to the front side of the abdomen, that they are on their feet the same day and that they have minimal to no pain 3 to 5 days after surgery.
Wow. That's after the robotic.
Correct. So our focus, as you said in my introduction, I'm a minimally invasive and robotic surgeon. Now, robot does imply minimally invasive on its own, so does laparoscopic. And that's why we try to focus now more on seeing who might be a good candidate for robotic or laparoscopic surgery, because it really is such a big difference in recovery and pain. And we love to see our patients come in and say, I barely needed any pain medication. I was on my feet the same day. And would you believe it? 3 days later, I had no pain. That's a great feeling.
And so to sum up here, even though we're talking about obviously the different kinds of hernias and treatments that you just mentioned, in a nutshell, what's the recovery time difference typically, robotic versus traditional?
With the traditional hernia surgery, we may see pain for a week or longer. And of course, you have a larger incision. So sometimes that's also a cosmetic concern for a patient. You may have patients who want the minimally invasive surgery because they don't want a large scar on their abdomen or their groin. And of course, that's completely valid. So not only does it give the advantage of less pain, quicker recovery, quicker back to activity, but also there's no denying that the cosmetic appeal of having a smaller incision on your abdomen or a few smaller incisions trumps having a larger incision on your abdomen that to some people might be quite unsightly.
So overall, considering everything we've covered, and you've been very thorough in covering it, Doc, what's the main message you have for people that may be considering hernia surgery?
Well, the main thing is, number one, you want to make sure that you have a diagnosis and you meet with a surgeon. So as I said, it's early diagnosis is best, not hesitating to basically talk with your physician about the fact that you may be concerned about a hernia, because late diagnosis, late treatment, that's where we run into the complications with the hernia itself. And of course, I wanted to mention that if you do have a hernia and it goes from something that you could easily push back in or something that never bothered you before, and let's say you decided to not listen to this podcast and you did ignore it for some time and now it's stuck, well, you want to immediately go to your physician or to the emergency room, because a hernia with the contents that are in your abdomen, which include your intestine, stuck is now a surgical emergency. So that's part of the reason that you don't want to delay treatment. So the number one message is if you have a hernia, talk with your physician about it. Make sure that you have an early diagnosis and treatment, because oftentimes the surgery may be a lot more straightforward than you imagine. That's the first thing. The second thing is, well, let's try to prevent hernias from growing or from forming in the first place. So heavy lifting, especially lifting that's well outside of the limits of what you should be doing, incorrectly lifting, chronic constipation, chronic meaning constipation that you've had for a long time. And of course, every physician will tell you this, but don't smoke, because smoking can cause chronic cough, but also it can weaken tissue in the area even further. So it can cause hernias to get bigger. Now, once we've established you have a hernia, you want to meet with a surgeon who's going to give you some options. You may choose minimally invasive repair as your option, because you may say, well, I prefer a slightly faster recovery. I prefer smaller incisions, and this is the surgery that I'd like. So you may pick the surgeon who does that. And I think that to have the laparoscopic or the robotic option and be able to offer that to our patients is a huge plus for us.
Absolutely. It sounds like robotic surgery just in the medical field in general continues to grow almost everywhere. Well, folks, we trust you're now more familiar with what a hernia is and how it's treated. Dr. Noman Khan, thanks so much again.
pleasure. Thank you so much for having me.
Same here. And a reminder that all content of this podcast is intended for general information purposes only, not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. Please consult a medical professional before adopting any of the suggestions discussed on this podcast. To learn more about the surgical services offered at Flushing Hospital Medical Center, please call 718-670-3135. For more information about all the services Flushing Hospital Medical Center offers, please visit flushinghospital.org. If you found this podcast helpful, please share it on your social media. And thanks for listening to Flushing Hospital Med Talk, a podcast sponsored by Flushing Hospital Medical Center. Hoping your health is good health. I'm Joey Wallach.